Hello, I'm Jon Salmanton-García from the University Hospital of Cologne in Germany, and today I would like to present you the latest EPICOVIDEHA publication, Outcome of COVID-19 in Allogenic Stem Cell Transplant Recipients. These are my disclosures and also the disclosures of the registry. And first of all, just as a little background, EPICOVIDEHA is an international registry for COVID-19 patients with hematological malignancies. We collect retrospective cases, meaning that once the patient has already released the hospital or has been stopped to be in follow-up since the beginning of the pandemic. So far, we have more than 8,000 patients already registered. It is a continuous recruitment, so we are still recruiting patients, and this means that in case you have interesting patients, feel free to contact us. And we are a collaborative effort. We grant with authorships to the partners providing patients, and with more than 150 contributing institutions in more than 40 countries. Specifically about this publication, Allo-HSCT, we can say first that allogenic HSCT is an increasing curative option for hematological malignancies, that these patients, however, are vulnerable to viral infection during their post-transplant period, and that specifically regarding COVID-19, the outcome of the infection in allogenic HSCT patients is almost uniformly considered poor. With all this in mind, we aim to retrospectively analyze the outcome and the risk factors for mortality in a large series of patients who developed COVID-19 after their allogenic HSCT. We collected patients from January 2020 to March 2022, a total of 326. Of those, almost 60% were male with a median age of 51 years old. The baseline malignancies were as follows: 60% AML or MDS, almost 20% ALL, and between other malignancies, we had 2% of multiple myeloma or 5% of chronic myeloproliferative malignancies. If we look at the time of diagnosis for each of the patients regarding, of course, the COVID-19 infection, 20% were diagnosed in the first pandemic wave between February and June 2020, 42% in the second wave between September and December 2020, and the remaining 38% in the third wave between January and March 2022, between January 2021 and March 2022. The diagnosis of COVID-19 was done 268 days after the allogenic HSCT, and in the 90% of the cases, the malignancy was at complete response at COVID-19 onset. We collected 91% of unvaccinated patients. We have to consider that many patients were coming from the first waves where no vaccine was available, and 56% of the patients require hospitalization. Of the overall number of patients, the 16% require not only hospitalization, but also ICU admission. And we observe a mortality rate of 21%, which was associated quite importantly to age, 3 or more comorbidities, ICU admission, and active malignancy. And it was also associated, but not as much as in the other variables, to recent allogenic HSCT, which was performed within the 12 months prior to the infection. With this, we can summarize and conclude that there is a large number of patients who develop COVID-19 following allogenic HSCT with a high mortality rate compared to the general population. It is of utmost relevance to check first the vaccination of patients after allogenic HSCT, and second, the availability of pre- and post-exposure prophylactic measures. And last but not least, keep in mind that mortality depends on age, comorbidities, time from transplantation, and COVID-19 severity. I would like to thank to all the contributors to this publication, and also just remind you that in case you want to participate and contribute your cases in EPICOVIDEHA, you are on time to do it, and you just need to send me an email or to contact via Twitter @Salmanton-García. Thank you very much, and see you next time.